One of the 9 new coronavirus cases confirmed in Scotland is the first to have been transmitted in the community. The number of people who have now tested positive for COVID-19 in the country has increased by a third to 36 people, up from 27 on Tuesday. After an update at 2 p.m. on Wednesday, Chief Medical Officer Dr Catherine Calderwood issued a statement confirming the case was unrelated to contact or travel. She said, "We have identified the first case of community transmission in Scotland, which is unrelated to contact or travel. This was identified through our enhanced surveillance scheme. It is important to emphasise that we are still in the containment phase. This case was to be expected and highlights the importance of the additional measures we have put in place to identify positive cases beyond self-identification." The latest figures were released hours after Health Secretary Jeane Freeman told BBC Radio Scotland that community transmission cases were to be expected shortly. The NHS and government are well prepared to deal with coronavirus, #COVID-19. There are some simple steps you can take to help. Please watch and share this video, down arrow. Follow @NHS24 for the latest health advice. Learn more, right arrow, https://t.go/jjq1n67spnpic.twitter.com/lad4axka. First Minister, at ScotGov, March 11, 2020. NHS Lothian has the highest number of cases, with 8 confirmed, while there are 6 in NHS Grampian and 5 in NHS Greater Glasgow and Clyde. A further 4 cases have been detected in Lanarkshire, as well as 3 in Ayrshire and Arran and 2 each in NHS Borders, NHS Fife, NHS Forth Valley, NHS Shetland and NHS Tayside. Ms Freeman warned the health service may need to draft in thousands of trainee doctors and nurses to cope with staff absence rates of up to 30% resulting from the outbreak. She said the Scottish Government is looking to double the number of intensive care units available due to the spread of the virus, which will be achieved by making difficult decisions to scale down elective work such as hip and knee replacement surgeries. Ms Freeman said NHS modelling showed the virus could result in an absence rate of between 25% and 30% among staff, who are at greater risk of contracting the disease as a result of caring for infected patients, even with protective equipment. To help cope with staff shortages, the NHS is looking at how recently retired staff can return to work, with Ms Freeman also saying there are something like 3,000 available nursing students as well as Year 5 medical students to call upon. She said in stepping up they would only be asked to do what they are trained to do and no more, but they could play an important role in caring for those who become sick. The Health Secretary added authorities are Jenny. For more on this story, visit the news article link.